I'm Cassandra, and I work with ThedaCare. I'm also a busy mom of 3. Doing it all is more challenging than ever, and that includes making healthcare decisions. So, welcome to Real Talk, where we cut through the confusion, chat with experts, and help you get the care you need for you and your family. ThedaCare recently opened the region's only comprehensive hospital and center dedicated to orthopedic, spine, and pain care. Everything is housed under one roof. And today, Dr. Erickson, an orthopedic surgeon, is going to take us around inside, show us what the center has to offer, and we're going to learn a little bit more about Dr. Erickson. So let's head inside. Sometimes it's easy to forget that providers are just like us. Let's get to know Dr. Erickson with a little Q&A. What's the most unusual question you've been asked before as a doctor?
One lady asked me, when can I return to mechanical bull riding?
Is that the most unusual injury that you've ever treated?
The most unusual injuries are the ones that seem to be escalating, a twofold. Number one, trampoline parks, and number two, the evolution of pickleball. Pickleball, which has taken over everywhere in our country, especially for people over the age of 45, has led to a significant number of injuries. Shoulder issues, rotator cuff, knee issues, ACLs, quadriceps tendons, you name it. But once again, 10 years ago, pickleball injuries were, at least in the northern part of the United States, just something we never saw.
What advice do you offer to people to stay injury-free?
To the best of your ability, you kind of have to think of somewhat of a cross-training regimen. So number one, flexibility. Number two, strength, some level of cardio training. Obviously, weight control and the weight discussion I have nonstop is critical. There's just, forces applied to the joints. But if you could focus on those things, those are probably going to mitigate your risk of injury. What is something that you wish patients knew before they came in to see you? Most importantly, I think when patients think they're seeing an orthopedic surgeon, they're one step away from surgery, and that could be farther from the truth. Yes, I do surgery, but the majority of care I still deliver is non-surgical. It is my job to figure out what would benefit from surgery, what wouldn't benefit from surgery. Seeing a surgeon does not mean surgery. It's just using my expertise to determine whether non-surgical or surgical care is in their best interest. What question do parents ask you most often? I think most often they ask me about training for sports, and probably my concern is the individualization of sports and sports training so early on. And we want kids to participate in a number of different sports. It's great for different body parts. If your child is going to be super successful, they don't have to specialize at the age of 8. It's time for myth versus fact. So we're going to ask Dr. Erickson a few questions. He's going to hold up his answer, and we'll see how many you can get correct. First one, myth or fact? Being strong can prevent an injury. Fact and a bit of a myth. So my explanation would be strength is important, but if you're strong but don't have flexibility and don't have otherwise good fitness, strength by itself is not a factor that would prevent injury. One can still get injured, and strength is a good component to prevent injury, but it has to be combined with the other portions as well, such as, once again, flexibility, cardiovascular fitness, etc. All right, next one. No pain, no gain. Big myth. Big myth. It's something that I say in my clinic all the time. Rarely is no pain, no gain a philosophy that we're going to employ. That's a historical way of training, somewhat to speak. So that is an absolute myth. Okay, that's an easy one to remember. Yeah. All right, applying an elastic bandage to a severely sprained ankle is good treatment. Myth. An elastic bandage isn't a bad first-line treatment, but it cannot be the only treatment. There are other modalities that have to be implied, and that can be a therapy approach, an anti-inflammatory approach, an icing approach. All of these things are necessary for a good outcome. Okay. Myth or fact, plantar fasciitis is a hereditary disorder or problem? Myth. It's a very common problem, but not hereditary. And once again, using the appropriate measures, one can get over that problem. Okay. If your back pain lasts more than 2 weeks and it keeps you from participating in normal activities, that's when you should see a doctor. After 2 weeks, I would say that's fact, okay? Now, there are some extenuating circumstances. Having back pain by itself and doing the appropriate conservative measures, if you have neurologic symptoms with back pain, that's something we want to see sooner.
Okay. And our final one, an ACL tear will end your sports career.
Well, that's a myth, okay? I do many ACL reconstructions, and one of the greatest joys I have is seeing my athletes back on the field, reading about them online, in the newspaper, etc. Unfortunately, there is a small percentage of people that are not able to return to play. There's no surgery that's 100% effective, so it's still very effective. We get people back, but that requires so much effort, energy, therapy. I'm just one small component in that.
Okay, there you have it, myth versus fact with Dr. Erickson. The internet offers no shortage of great videos, so we gathered a few of the most common injuries and some of the most famous sports injuries, and Dr. Erickson is going to react. And we must say that this does not replace any medical diagnosis or advice.
Okay, let's start the first video.
If you can bear to watch it, take a look, but it's a terrible looking injury.
Yeah, anytime I see a video and you see a deformity of the leg or shoulder, any body part in this case, and it happens unfortunately not uncommonly, especially in contact collision sport, less likely than basketball, all I can think about, oh, this poor kid, his poor family, and the long road and recovery ahead. I also then think about, well, yep, these are bad injuries, but this is what we take care of commonplace. Although many people are aghast by what they see, for us it's like, okay, we see this, here we go, let's treat it appropriately. Let's go on to the next video.
He talked about the other day, it gets worse as he goes. Towards the end of the round, it just fails and the back just gives up.
I watched the knee buckling after a big torque, and number one, I can somewhat empathize at times having back pain myself. Maybe that's why I'm retired from golf. But to see someone clutch down, buckle to their knees, I can think about the excruciating pain they're in and think about, oh my gosh, he still has to somehow continue in a golf tournament. And obviously the average weekend hack compared to the professional golfer and their torque, I just can't imagine the forces being applied through their back and how someone can stand back up and look at that golf ball the next time and strike it appropriately. A champagne cellar, oh yeah. I see something like this, well, at least he's still happy. I think to myself, okay, yep, celebration, what could go wrong? The next thing you know, you've got your goggles on and you're on your backside. So fortunately, he didn't look like he was in too much pain. Maybe the next morning he'll wake up in more pain. A slip and slide, oh my gosh, my favorite. Especially when you see, oh, exactly. I've seen this in my own backyard, so I can completely understand this. Of course, adults versus kids, big difference. Big difference in pliability, flexibility. Oh my gosh. From the high dive, almost off. That actually scares me way more. I think about people striking their head on the diving board platform and what could happen there. If you could all recollect back to like Greg Louganis way back in the day, that's much more scary for me. I always tell people we can put Humpty Dumpty back together, but head injuries, neck injuries, I get way more concerned about. Of course, my neurosurgery colleagues are here, as well as an orthopedic surgeon. Motorcycles, etc., helmets on wet pavement, that's a recipe for disaster. At least they were traveling at a low velocity.
This new center has specialized features, providers, therapists, pharmacy, all under one roof. So very exciting. So we thought today we are going to test your knowledge of the center while playing an old-fashioned game of operation. So I'm going to ask you a question about the center, and you're going to pull out a piece out of Cavity Sam while you're answering the question, and we're going to see how many you can get right out of 5. Okay, first question, Dr. Erickson, where is the facility located?
The facility is located in North Appleton, off of Capitol Drive. You can be seen by Highway 41 in the Ballard exit.
Okay, you got water on the knee. All right, 1 for 1, we're good. Next question, name one special feature that the center offers.
I think one amazing feature is the warm water pool. I think that is very, very unique, and given its size, incredibly special in the Fox River Valley.
Okay, piece number 2, out. He's still alive so far.
The shoulder's better already.
We're good. What partners came together to make this project a reality?
3 partners, ThedaCare, ThedaCare Orthopedics, and Neuroscience.
Ooh.
3 for 3.
3 for 3. I thought you were buzzing on that one. Okay, next question. Name one reason someone might be a patient here at the hospital or center.
Well, any musculoskeletal condition can cause that. Oh, I buzzed.
You buzzed.
That was the coffee this morning.
We still trust your skills as a surgeon, even though you buzzed on that one.
Okay. 3 out of 4 ain't bad.
No, that's pretty good. Okay, last question. What is the name of the gentleman that you are performing surgery on right now?
Cavity Sam.
Cavity Sam. Let's see, can he do this?
I'm trying to get the frog out of the throat, and the frog does not want to come very easily, but boom.
He got it. And Sam is still alive. If you are leaving the medical center, the last thing that you want to do is probably go home and cook a meal. So we have some really great options. Joining me right now is Marie Weiske. She's the Director of Customer Experience, and you have a lot of background here and a lot of information about the thought that went into the food provided. So start off by telling us that unique portion of whenever you're being discharged from the hospital.
So, and I keep looking down because this looks amazing, but so when you discharge from the hospital, that's probably the most exciting part of our food, is that our team works together to get it to you. We'll let you look at that menu. You can pick what you want, what your family wants. You know, if you have kids at home, what are they going to eat? Because, you know, you might not have the energy to cook that when you get home. Our nursing team works with our dietary team. We get that meal ready for you before you're ready to go. You know, obviously we have those perks where we get your car ready, we get all those pieces, but then that meal is that extra mile that we like to go.
The food options here are extremely unique. Can you talk about what went into planning and preparing those options?
Yes, so they're unique because they actually were created by our team. A lot of the pieces that we do have involved our nursing team, our dietary team, everyone working together to think of ideas, think of approaches. And you look at this food and it looks delicious, but also tastes delicious. And what I like is that each one of these was, so much thought was put into them. I mean, we have some of these at our other locations, but then some of them are unique to our site here.
All right, Marie, one more question for you. You've had an opportunity to look over the menu and help with all of the design and planning too. So what are you most excited about on the menu?
I would say, I mean, that's a hard question, but I would say the chicken Caesar wrap, okay. Maybe with the potato chips and a cookie.
Perfect. Everyone's favorite, right?
Yes, and I think we should try it.
Okay. The center has some very unique options when it comes to the patient experience, and Marie is going to take us on a tour to explain some of those areas. So Marie, let's start off with check-in.
So with check-in, we have a few different features that are pretty exciting. When you get here, obviously with the population we're taking care of, we have our valet, so our complimentary parking to help you get in a little easier. You can check in on your phone, you can check in on this kiosk right here. If you're not comfortable with that, we obviously have our registration team members that can help you check in, and then from there we help you get to your appointment.
All right, let's head to the next stop on the tour. Marie, another unique feature, surgery. So can you tell us about some of the options available?
First, we have everything under one roof, so that's convenient. We try to make everything as easy as possible, but what also is really exciting is we have robotic surgeries, we have services in these areas that we didn't have before. We also have worked very closely with our providers to make sure that we have some seamless transitions between the different areas of our building.
Very neat. All right, let's head to the next stop. Okay, we are in one of the patient rooms. Will you tell us about it?
Yes, so as you can see, they're absolutely beautiful, but more importantly, they are completely geared toward our patients. We have bedside tablets that you can use to order food, to call your nurse, whatever you might need. You can do similar things up on these screens. You can even put pictures of your family on the screen to help you toward your recovery.
That's wonderful. All right, next stop. We are in an apartment simulation. Marie, what is this doing in a hospital?
Well, this is where we take all of the different aspects of your life and try to pull it into how can we help you prepare to go home. So it has all the amenities that you would have in your home, and we help you reenact those pieces so you feel more comfortable and adequate when you get home to be able to do those yourself.
All right, let's head to the next step. We're now in the therapy area. Some very neat features in here. Can you tell us about it?
Yes, so this area helps us make your therapy more relatable to your life and your hobbies and your family. So whether it's you or your children or whoever needs the help, we have a pitcher's mound, we have basketball, we have a pool for weightless therapy, but all those different pieces that you might do in your life and how we can incorporate that into your therapy.
Marie, thanks so much for taking us on the tour, and thank you for watching this episode of Health Inspired Real Talk. We'll see you next time.
At ThedaCare, our mission is to help you live your unique best life. And we want to know what kind of questions you have when it comes to your health care. Leave your questions and comments below. And be sure to like and subscribe so you see the very latest in this series.